Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Now, management of dumping syndrome. So in the dumping syndrome, now management of dumping syndrome, the main management is we have dietary therapy. In the dietary management or dietary therapy, the diet is mainly given so that we can reduce the jejunal osmolarity. So diet is given such that we have to reduce the jejunal osmolarity. So we advise the patient to give multiple small meals are given to the patient, and food which is low in carbohydrates and rich in fats and proteins is advised. Food that is low in carbohydrates and rich in fats and proteins are absorbed, because if they are low in carbohydrates, there is no sudden increase in glucose, and thus the dumping syndrome can be prevented. Now, liquids during meals should be avoided, because if there is more liquids in the meals, so there is more mm, fluid in the stomach, and which goes into the duodenum at once, leading to increased diarrheal symptoms and increased vasomotor symptoms. So these are the dietary management. Then in the medications, somatostatin analogs or octreotide are tried. This is only given if the actually normally if you see the dietary therapy will be successful, but if this fails, then the patient is given if it fails, then the patient is given somatostatin analogs or octreotide is given to the patient in such case. So octreotide or somatostatin analogs are only given if the dietary therapy fails. If dietary therapy fails, octreotide is given to the patient. Then, then if you see the surgical management, actually surgery is rarely required in this case of dumping syndrome. It is rarely required because most patients will improve with dietary management itself. Then if it is required, what surgeries do? You will have to use the antiperistaltic loop of jejunum between the residual gastric pouch and intestine. We use this jejunum, and we can convert the Billroth 2 into Billroth 1 anastomosis, and or you can even convert these Billroth 1 and 2 to Roux-en-Y anastomosis can be done in the patient.
thank you and thank you for watching.